I'm Dr. Art Mollen.
And I'm Olivia Fierro.
Welcome to Hope You're Feeling Good. I've practiced medicine for over 50 years and seen the face of medicine go through a complete metamorphosis. Physicians have more diagnostic options and tools, however, less time to personalize patient care. The healthcare landscape has become more difficult to navigate, so you'll need more information to advocate for yourself. I'm here to answer your questions as well as educate you with the latest breakthroughs in medicine. At the end of the day, I hope you're motivated to take better care of your health. I'm Dr. Art Mollen.
And I'm Olivia Fierro.
And we hope you're feeling good. We're going to advocate for you. We're going to educate you. We're going to motivate you. But we're also going to have a doctor on today, Dr. Frank Lipman from New York City. And he advocates a lot of different alternative medicines that are very, very interesting. He thinks that Western medicine is consumed with medications. Guess what? He's probably right.
We've got two doctors for the price of one. And by the way, the price is free. So what a deal.
Exactly. You might as well listen in. And speaking of medications, let's talk about one of these medications that we have.
Oh, so many medications are top of mind for so many folks right now. In particular, these, what you call them, the GLP-1s. I was telling you, they're so pervasive. I heard my 11-year-old son humming the Ozempic jingle from the commercial the other day.
Oh, my God.
Let's talk about this. Everybody is interested in trying these.
Yeah, no question about that. There are a lot of different medications that fall under these semaglutides, as they're referred to. And so we have the Wegovy, we have the Mounjaro, we have the Ozempic, we have Rybelsus, which is actually a tablet as opposed to an injectable. So most of these medications are injectables where they inject it once a week, and people usually lose weight. I mean, I've seen people lose up to 20 pounds in a month. So it can be rather efficacious for people who are significantly overweight. But for the person who's maybe 5 or 10 pounds overweight, I don't suggest that they start on these types of medications at all.
And we really still don't know how long it would be safe, say, to stay on this.
Exactly. So these medications, it's interesting how they work. So first of all, what they do is they actually stimulate your pancreas to release more insulin. So it helps to lower your blood sugar down. They actually affect the emptying of your stomach so you feel full longer. And they also affect the hypothalamus in your brain. So it suppresses your appetite and you're simply not as hungry as you would be. And then it affects the liver as well because the liver stores glucose. And glucagon is basically a sugar, and it basically is released. So it prevents that release of sugar. So the original medication was suggested for treating diabetes, which it was very, very effective. And those medications have actually been around for more than a decade, but only recently do we realize that it's very, very effective for weight loss. But the only one that's approved for weight loss as well as diabetes is the Wegovy. The others are simply used what we call off-label by physicians.
I've heard from friends and people who have tried these already and say, yes, extremely effective quickly for weight loss, but they even had to remind themselves to eat because they really, truly weren't hungry. And that could really create some problems.
Right.
I mean, you could be at a nutritional deficit.
Yes, because it can cause some nausea, vomiting, diarrhea, some abdominal cramping. So there are some side effects. And again, as you suggested, we don't know the long-term side effects of what these medications are. How long can you stay on it? One of the studies suggested that possibly thyroid cancer, liver cancer, they could be potential dangers that result from some of these medications. So it's yet to be determined how long you can actually stay on these GLP-1s.
All right. Yeah, it's a lot to think about. So I love speaking about that with you in particular. Dr. Mollen, okay, so instead of something that we're going to inject or take as a medication, there's another alternative out there that can be described as invigorating, to say the least. Let's talk about ice plunges.
Right. So ice plunges, it's really interesting. So first of all, the ice plunge is about 50 to 60 degrees. So that's the temperature that you get into it. Now, it's been suggested that when you go in, only go in for about 30 seconds. If you go in for more than that, it's going to shock your system the first time, and that's going to release norepinephrine in your brain, and you're going to be out of sorts. So you want to be careful that you don't get shock therapy from jumping in and get hypothermia. So the first time, 30 seconds, and then you gradually build up for 3 minutes. Maybe sometimes people are really brave and they're able to stay in it for about a 5-minute period. The other thing is you probably want to go in these without putting your head in because, as you suggested, digested, you can get a little claustrophobic when you do that.
So you can be immersed in there. People are using these, I guess, these cold therapies in a variety of ways, whether it's immersing yourself in the water as an ice plunge or doing some of the cryotherapy machines and tubes that are out there.
Yeah. So what they do is they constrict your blood vessels, and then when you get out, then your blood vessels dilate, and so you get more blood circulation into different areas. It can boost your mood. It can affect your immune system. It suppresses inflammation in the body, so therefore your muscles will recover much more quickly if you do these ice plunges. So a lot of athletes are using the ice plunges as a way to actually improve their overall fitness and their performance.
Asking for a friend, I've heard that it can be helpful with cellulite.
Yeah. So it doesn't affect cellulite.
Okay.
Unfortunately, and they're tout a lot of different potential benefits from different clinics and I've seen, but realistically, it does not affect that. It boosts your metabolism, so it can potentially burn body fat, but it's not going to eliminate that cellulite that you may have.
We could be billionaires if we could come up with the fix for the cellulite, right?
That's exactly right. Everybody's looking for cellulite removal. Liposuction is probably one of the only ways to remove the cellulite.
So from cellulite to supplements. Supplements are, the answer to so many of us who we feel like, okay, we know that we should be eating, these perfect meals every day and, lots of the dark leafy greens and all of it. But maybe we know that we fall short a little bit.
So in researching the supplements, and first of all, supplements are not FDA approved. So they're not regulated by the FDA. So you never know what you're getting with some of them. So you have to be quite careful where you buy it and, from whom you're buying it. If you're buying it at a health food store, if you're buying it online. So be very, very careful of that. So I researched out which ones were the most popular. So one of them was turmeric, another was castor oil, another's called brain boosters, which are nootropics. Then there's creatine, and then, of course, melatonin. So the melatonin, we can start with that. That's for sleep, and people like to take melatonin for sleep, and it can reset your biorhythms. It's excellent for jet lag. And with melatonin, it's not like a sleeping pill, so it's something that you basically would take probably an hour or two before you go to bed, because it resets those biorhythms and allows you to sleep a little bit better. The dosage can be anywhere from 1 milligram up to 5 milligrams. So be careful with how much you take, because you can actually have a hangover from taking too much melatonin. The next one is the turmeric that I mentioned. Now, turmeric comes from the Ayurvedic medicines, the East Indian medicines. It's in curcumin, and curcumin is something that you actually put in foods and things like that. So turmeric is an anti-inflammatory, but it can affect your kidneys, and you have to be careful if you take too much. But it does work, and people who take it say that it helps them in terms of their athletic performance with their arthritis, rheumatoid arthritis, osteoarthritis. So it can be a very, very effective anti-inflammatory. Have you ever heard of the turmeric?
Oh, yes, absolutely.
Yeah. So I think it is something that can potentially be beneficial, and people may want to consider taking that. You can take it up to like 1,000 milligrams or 1 gram a day. So again, depending upon where you're going to buy it, but
it's also a popular ingredient in a lot of these juice places.
In the juice place, yeah, exactly. So you probably, if you're taking turmeric over the counter, you're taking it on a regular basis, simply have your kidney and your liver function studies done, because it can affect some of those. The other one is creatine, and creatine is something that the bodybuilders like, because it boosts muscle performance. It actually causes your body to retain more water. So by retaining more water, it kind of pumps up your muscles, and you look a little bit stronger, just even in appearance wise, even though you don't. So the suggested research is 2 to 4%. You can increase your muscle mass. So for the garden variety person, myself, you, we're not worried about the 2 to 4%.
We're not doing a whole,
No, right. If I can boost it by 20%, now I'm really interested.
Now we need a new jacket size, right?
Exactly. So I would suggest for people, they don't necessarily need to take it. It's not going to do that much for them. But for the competitive athlete, the bodybuilder, they may want to take it, but it can cause an increase in your liver function study. So again, it's another one that you want to, get checked out, on a regular basis. Sometimes people have some GI upset. So it can cause some nausea and vomiting, and you have to be careful how you take it. And, just start with smaller doses, in the beginning. The other is castor oil. Castor oil is basically the only thing it's FDA approved for is basically, if you have constipation and you're looking for a laxative. So the castor oil is, they say it improves vision, improves wrinkles. I'm not certain that it can really do all of that. And then the final one are the brain boosters. And these are, they come in gummies, they come in, powders and tinctures and, pills and things like that. So a lot of them contain ingredients that will act as stimulants. So it's like ginkgo biloba, taurine. These are things that are put into a lot of the different supplements, and they kind of boost you up a little bit. But you have to be careful because they can increase your heart rate. They can increase your metabolism a little bit. They can increase your blood pressure. So be very, very careful how much of these nootropics that you're actually taking, and the so-called brain booster. So just simply look at the labels. If it has something like taurine in it, or ginkgo biloba, realize that they're actually stimulants.
That is a topic also that, I've read a lot about and heard a lot about, and especially it was all these, articles about the shortages of some of the prescription medications that are, like the Adderall and the various ADHD medications. And people were trying to explore whether these over-the-counters could be replacements for that.
Oh, yeah, no question about it. A lot of people are taking those types of medications to boost their brain power. If they're starting to have a little bit of dementia as they get older, they may try some of these alternatives, but I don't suggest them. And have your blood pressure checked, have your heart rate checked. If you start to experience any type of nervousness or any increase in your blood pressure, discontinue those. I mean, a lot of them contain a lot of caffeine, like 300 milligrams of caffeine, the equivalent of a couple cups of coffee.
And if I remember correctly, the Picture of Fitness yourself, Dr. Art Mollen, hardly does any supplements.
I don't do any supplements. I don't take supplements. I don't take any vitamins, minerals. I studied these for many, many years, and I just never saw an improved performance in my athletic prowess. Even though that's slowing down over the years.
Eventually, even to you, it'll
unfortunately,
happen.
but at least I'm still out there. So
save us a little money because some of those things are really expensive.
You can't hit a moving target, so keep moving. So let's go to some questions.
All right, we've got some great ones. Yes,
okay,
we've got some great ones for you today.
I better get ready and get into the clinic.
The doctor is in right before we have double your pleasure, 2 doctors. So questions coming up. The doctor is in. We've got the stethoscope and the lab coat. We are making it official. Dr. Art Mollen ready to take some questions. And the first one, doctor, that we have for you is from Kay, who recently had a colonoscopy. And after surgery, her blood pressure really shot up. So the doctor prescribed some blood pressure medications. And now her ears are ringing. So what's up with this and what should she do?
Yeah, so after you have a colonoscopy, you're getting anesthesia. So it's real common over the first 48 hours to have a kind of a rebound effect where when you're having anesthesia, it affects your blood pressure, it goes down. Now you come out of the anesthesia and for a period of up to 48 hours, doesn't mean everybody gets this, but you can have a rebound effect where your blood pressure could be high. So patient comes out, blood pressure's high. They prescribe 2 medications, lisinopril and amlodipine, both very, very effective blood pressure medications. But sometimes it's a little premature to prescribe those medications. And so what I would do with a situation like that, if it's causing the ringing in the ears, and patient had not had that before, then I would suggest at least reducing one of the medications and continue to stay on the other medication. So that way you're going to see if the blood pressure does go down, if it is affected or not. And then at some point in time, you may be able to discontinue both medications again after that 48-hour period. So it's not uncommon. And again, blood pressure can affect the ringing in the ears. And if your blood pressure goes up and your heart rate goes up, all of those things can affect ringing in the ears.
Hopefully a temporary situation because of that. Okay.
Yes.
This one is coming from Mary Ann, who says, I'm having severe back pain with numbness radiating into my leg. Pain pills are not helping. I've had previous surgeries. What else can I do?
Yeah. So when you've had previous surgeries for your back, usually you develop post-traumatic arthritis. So you have a lot of arthritis that affects those discs. And even though they may have removed a particular disc, it's still going to affect the vertebrae in that area and then cause some pain. And if that pain starts radiating down your leg, and that's called a radiculopathy or a neuropathy. And so it goes into your leg, it can cause numbness and things like that. But if you've had previous surgeries and the pain medications are not helping, now I'm going to suggest taking anti-inflammatories. There's a lot of different ones that are out there. Diclofenac is one that I like. It's not addictive. You can get off it at any time. It doesn't have a lot of serious side effects. It's not a steroid. The other thing would be to use a back brace. A back brace often helps to stabilize that area. And then the final type of medication, what I would suggest is something called Neurontin or gabapentin. These medications affect the way that you perceive pain. So they're affecting your brain so that you perceive pain a lot differently. But if you continue on the pain medications that are not helping, you have to try some alternatives. I don't suggest having another surgery or anything like that. So again, those medications, Neurontin, gabapentin, another one's called Lyrica, these would be medications that could be possibly helpful.
Oh, Marianne, we feel for you. That is rough. This is coming from Cindy. Cindy is 36 years old and has chronic insomnia. So she has been taking melatonin, but really it's not helping. So any other suggestions?
Well, I think if you have chronic insomnia, you have to identify what's the cause of it. Is it anxiety? Is it a relationship problem? Is it something that's going on at work? I mean, are there emotional issues that are affecting the insomnia? So I would address those situations. Are you having anxiety with it? Are you having any panic attacks? Are you having some depression? All of those things will affect sleep. And if that's the case, then you can take some SSRIs, selective serotonin reuptake inhibitors. That could be Zoloft or Prozac or Lexapro or Effexor. I mean, all of those medications can be very effective for helping that type of chronic insomnia, and they could turn it around. I mean, again, if you've tried the melatonin, it's not helping, then of course exercise. I'm not going to, I can't underscore enough the importance of exercise. Make sure the temperature in your bedroom is down to probably 70 degrees, maybe even 68. You want to keep it pretty cool. And, meditation helps, yoga helps. All of those things can be alternative remedies.
And you've talked a little bit in the past about kind of that sleep protocol and having a good regimen.
Schedule.
Yes.
Everything is scheduled. Try to just be regimented about what you're doing. The time you go to bed, the time you get up. I have an Apple Watch and it tells me it's time to go to bed. It's like, well, wait, it's like
I'm right in the middle of something.
I'm not ready to go to bed. I mean, what are you telling me? It's time to go to bed.
Yeah.
So, so there are a lot of different ways, but scheduling is good.
Yeah. Cindy, you're very young still. You're only 36. But also I've noticed over the years, the caffeine stays in me longer. So, where I used to be able to have coffee at night if I felt like after dinner or something, forget it.
Yeah,
that would be deadly.
No coffee at night, and don't exercise at night
right before
either.
bed.
Because that's not good. That's going to keep you up.
Yeah, then you're all hyped up. Okay, this one is a question about a real change of diet. I recently stopped eating meat and instead am eating more salmon. So the question about the salmon, wild or farmed?
Yeah, I think any salmon is good, and it's certainly a great alternative to eating meat or eating chicken or anything like that. And salmon is one of the highest fish outside of, say, tuna and sardines in terms of the eicosapentaenoic acids, basically the fatty acids that we're looking for and, things like that we try to get in our diet. So I think that, taking, any type of salmon into your diet is going to help to reduce inflammation. It's going to be, beneficial to your health overall. It's going to help your immune system. So switching from meat to fish is a great idea. And if you want to incorporate, again, the sardines with it, they are very, very high in these fatty acids,
Salmon is people are a little more enthused to incorporate into the diet than the
Yeah,
sardines usually, right?
there's no question about it. The omega-3 fatty acids are really good. They're very helpful.
Can't go wrong with that. Well, I'm feeling better already, Dr. Art Mollen, and I hope that everybody who's joining us is as well, and even more so because next up is your conversation with Dr.
Yeah,
Lipman.
we're going to have Dr. Frank Lipman on, and he's a leading health advocate in alternative medicine, and he's from New York City, has authored 5 books. He's really one of the leading advocates in alternative medicine in the country, and he practices what he calls good medicine, and that eliminates a lot of the medications that it's so easy for physicians to prescribe in these days. So yeah, next up is Dr. Frank Lipman. Well, I have Dr. Frank Lipman on the phone with me, and it's great to be able to talk with you. He's a leader in functional medicine, resides in New York City, chief medical officer for Hardy, a digital clinical offering tailor-made health programs for people, and inflammation he talks about as the root of chronic disease. He has authored several books and on how to be well, new health rules, 10 reasons for feeling old, better sleep and better you, and also the new rules of aging well. So, Dr. Lipman, great to have you with me.
Nice to be with you.
So, let's talk about new rules for aging well. What are they?
Well, there are a lot of there are a lot of ways you can stay well as you get older. That was just the title of the book, but from eating a little bit less, maybe eating more protein, staying active, exercising, especially as you get older, doing some weight training or strength training. You don't want to lose muscle mass. Intermittent fasting can be helpful. Social connections, having a sense of humor about it. Making sure you get enough sleep. What you eat is important, not only when you eat. So, cutting back on sugar as much as possible, cutting back on alcohol. I can go on and on and on. There are lots of little things you can do on a daily basis that make a big difference to how you age.
Yeah, now, I know when they've studied people who live to the ripe old age of 100 and they have higher longevities than a lot of us, they talk about 3 groups of people: the people in Sardinia, Italy, they talk about the people in Okinawa, Japan, and they talk about the people from Loma Linda in California. And again, it all comes back to a lot of dietary changes that they have, and it all relates to family ties. That seems to be a critical factor in people who are able to live to 100, that the social connection becomes so critically important for people as they get into their 80s and into their 90s. Is that your feelings as well?
Absolutely, no question. I think the blue zones, which is what you're talking about, the common denominator is really, people who have a meaning in their life, people who have social connections, a support, people who feel part of a community. Community is very, very important. The dietary stuff, I'm not so sure that a vegetarian-based diet is the best thing for everyone. I don't think there's one right diet for everyone. I think different diets work for different people. I think as a general rule, cutting back or cutting down on as much sugar as possible, grains, as few grains as possible, and as little alcohol as possible, which probably goes against a lot of the blue zones, or some of the blue zones are helpful.
Yeah, certainly the Sardinians in Italy, I think they included wine as one of their main factors for longevity. So
I'm not sure. See, we extrapolate a couple of things that probably are not correct, is my take on it. I don't think too much wine is good for anyone. But the social context of how you drink the wine is probably what helps. So if you're drinking wine around a table with people you love and you feel part of a community and is supportive, that to me is what the benefits of drinking wine are, more than the actual wine itself.
Yeah, and probably at the end of the day, picking the right parents is extremely important as well in
Yeah,
terms of
to a certain
longevity.
extent, I think it's less genes, but I do think genetics play a part. Absolutely, yeah.
Now, in terms of, say, inflammation, we talk about that as the root cause of chronic disease, as you've mentioned in some of your books that you've crafted. Uh, how can we reduce inflammation in the body?
Well, I think inflammation is one of the underlying, physiological mechanisms of many of the chronic diseases of the disease or of the diseases we fear most today. Um, there are other mechanisms, whether it's mitochondrial dysfunction or um, it could be a number of things, but I think inflammation is a major factor, and a lot of inflammation that many people have is actually stemming from the gut. So, there are many causes of inflammation, from eating too much sugar, maybe even eating too much grains, not exercising enough or even over exercising, not sleeping enough, not dealing well with stress. Those can all trigger inflammation to a certain extent, foods being the biggest trigger. But one of the commonest causes that I see of inflammation that most people don't talk about is an imbalance in the gut microbiome, or inflammation stemming from the gut. And I think that's, the gut microbiome is one of those hallmarks of aging, or a factor in aging that people don't talk enough about.
You talk about AKG. Can you explain what AKG is?
You mean alpha ketoglutarate?
Correct.
I mean, I don't know how significant that is. That I sometimes recommend it as a supplement. Um, you know, there's this concept of ketosis that I think is probably important in health and aging, and partly why I'm actually a fan of cycling people in and out of ketosis, or where we start using other foods than carbohydrates to break down, which is actually very good for our bodies in many ways. So, I use alpha ketoglutarate occasionally, sometimes, as as an extra supplement to actually help people, you know, with their aging. I mean, it's definitely not top of my list, but it is on my list.
Do you have an opinion on the new GLP, ones, as far as people taking them? I mean, people are taking them obviously for weight loss, but they're taking them for depression and anxiety and
Yeah.
panic attacks, and I mean everything known to man.
Well, I actually do have a strong opinion. I actually think they're first of all, they're peptides. They're
Right.
actually, not typical drugs per se, although the pharmaceutical industry has sort of made drugs out of them, but they're peptides, and
Correct.
peptides work on a cellular level and have multiple downstream effects, and often beneficial effects. I'm a huge fan of peptides. So the GLP-1 agonists, Ozempic, Manjaro, are actually typical peptides. So they were developed for diabetes. And the thing about peptides, because they have multiple downstream effects, and these GLP-1 agonists, being peptides, not only will affect diabetes, but can help with your weight, can help with your lipid numbers, your immune system, and a whole host of things. I actually think low dose, I think peptides or GLP-1 agonists used well and intelligently, and not overused and overdosed, and actually small doses, people talk about microdosing, but small doses, very low doses of these drugs, I think, are probably powerful anti-aging drugs. I think very low doses of these peptides are going to be the hot new anti-aging drugs in the next couple of years. So yes, I'm a big fan. I've seen unbelievable results. I've also seen people use too much of it and not use them smartly and not cater to the common side effects, that they can become problems. But I think if used intelligently, I think they're incredibly powerful drugs that could really, and they are on some level changing the way, they're changing people's health. But I think if they're used even more intelligently, there's actually a bigger place for them in medicine.
Now, it seems like we haven't seen enough information for the long-term effects
Sure.
of these GLP-1s. So, I mean, I know there's been incidents where there's a relationship to thyroid cancer, to liver cancer. I mean, do we have any insight into what the potential long-term effects are?
Yeah, we don't really. But, that's what I'm saying, used intelligently. I think low dose, I think they could be and are incredibly powerful peptides and drugs. There've been many people using them before they became pharmaceuticals with great results. Once again, they drugs. They need to be used smartly. All drugs have effects, both positive and negative, and you've got to measure them. But I think for a lot of people, as we get older, as we get prone to pre-diabetes or carbohydrate metabolism issues, lipid issues, weight gain, a lot of issues and I'm not saying you can't deal with these issues without drugs. I mean, that obviously is the ideal way, is food, diet, social connections, sleep, etc. But I think for many people, these drugs are incredibly helpful. So I'm not against them. I'm just against often the way they're used. So yes, but I agree with you. I think we don't know the long-term effects, but I do think at a low dose, they're probably relatively benign. You got to be smart about using them. And the commonest side effect that I've seen with them, I don't see people using high doses, but even in lower doses, if people are not eating well and exercising, especially doing strength training, they can have problems because then when they lose weight, they don't only lose fat, but they lose muscle mass, which is a big issue as we get older. So, listen, they're not benign. Don't get me wrong. I'm not saying these are benign drugs that should be used like candy, but I do think there's a really big place for them in the way we practice medicine and even in anti-aging medicine.
Yeah. So Rybelsus is a pill that obviously is the same thing. Do you think that's as efficacious as, say, a Wegovy or Ozempic
I don't know, to be
Giorno?
quite honest, Art. I'm not sure. I think, um, and this is not coming from a place that not I know. The problem we've always had in the peptide world with peptides is when they taken, because peptides are just small groups of amino acids. When they're taken orally, they get broken down. My fear is, but I may be completely wrong, um, when you start altering these peptide formations, you're not going to get all the same downstream effects or exactly the same effects. So if they have managed to prevent the breakdown of the peptides, very possibly. I don't know. I just have had experience with injectable, the tirzepatide, which is a Manjaro, the semaglutide, which is a Ozempic. And I think there's a big place for them in medicine. I just don't know about the oral versions yet.
How about as far as dementia and Alzheimer? Do you have any
Yeah,
insight into that?
yeah. I think there's there's. I just saw a recent paper that uh, that these GL1 agonists can prevent Alzheimer's, which sort of once again makes sense with these downstream effects. Now,
Sure.
is it because Alzheimer's, some people call Alzheimer's diabetes 3? Is it because of that? Is it just the sugar insulin mechanism? I don't know, but that's a big mechanism in Alzheimer's, the whole insulin metabolism or blood sugar insulin metabolism. So that could be it. But yeah, I mean, I think they're very, very interesting drugs, and I'm not one for drugs.
Do you have any specific recommendations for patients as far as blood testing that they need to have done prior to, you know, basically starting on any of these medications or trying to get evaluated for, whether it's not only diabetes, but potentially Alzheimer's or dementia and things like that?
Yeah, so I just think a standard work, I do an extensive workup. I think that's all one needs. But I'll tell you my experience. I tried to do not for weight. My fear actually was I would lose weight. I didn't do Manjaro to lose weight. I just did Manjaro. I wanted to see what I would, the experience. So I did a low dose of Manjaro for a month, and it was very interesting because you lose your appetite. So I had to force myself to eat. I couldn't eat much. I got nauseous after eating too much. And I think
Uh-huh.
what happens with people push down the food and it becomes a problem.
Right.
So I think they work. They definitely work. They're interesting drugs. I just think you've got to be very careful. You've got to be smart about it. You can't just take them. So I think the workup initially is not so important as important is or more important will be what you do when you're on them. You can't push the food down. You've got to be aware that you're not going to want a lot of food, so you really need to eat nutrient dense food. You've got to eat enough protein. You've got to do the strength training. You've got to be smart about it because they're very powerful.
So instead of using laboratory mice, you used your own body as the experiment?
Exactly, which I often do. I often experiment with these things. I mean,
Right.
I'm quite intrigued by peptides, and to me, that's just another peptide. So, as I said, my fear, I don't want to lose weight. My fear was, losing weight. So
Sure.
but I did a very low dose. But I think even at a low dose, I found the effects a little bit scary because of how powerful they are. And if people don't listen to their bodies and sort of cater to what's going to happen, there can
Sure.
be problems. Yeah.
Yeah. Yeah. I think people need to, again, get their kidney function studies, make sure
Yeah.
their
Yeah.
GFR is okay, make sure their hemoglobin A1C is
Sure.
not out of range or below where it should be. And, so if they can get these types of blood tests. How about cholesterol? Do you have any feelings on cholesterol, just in general?
Yeah. So once again, I'm less concerned about total cholesterol than more about apolipoprotein B, which is
Right.
a lipoprotein that carries all the cholesterol. So what I do in my practice, I do what we call an advanced lipid panel. So we do the standard panel, triglycerides, LDL, but we
Yes.
do an advanced lipid panel. We look at the particle size. Most important, we look at apolipoprotein B and apolipoprotein A. We look at all the inflammatory markers. So I look at the whole package. And to me, the apolipoprotein B is more of an issue. And then if that is high, then we'll send people for more testing. So there are two tests we do, either a calcium score test, which is very cheap and just looks for calcification in the artery, but
Sure.
now we can actually do a clearly test, which actually looks for not only calcification, but also soft plaque and non-calcified plaques, which is much more expensive, but actually more accurate. So when you pair a high apolipoprotein B with plaque in the heart, then I think something needs to be done. And unfortunately, for cholesterol or apolipoprotein B numbers, a lot of it's genetic. It's, the cholesterol is made in the liver. So diet may not play a big part. So, it's there are many factors, but I'm a bit wary of statin drugs. Not that I'm against them, but statin drugs have side effects. Like most drugs, you've got to use them intelligently. When I do use statins, I use them at a low dose. But statins are mitochondrial poison, so you've got to be careful. I think the new PCSK9 inhibitors look more interesting as drugs if you want to bring down apolipoprotein B. But so you need to look at the whole gestalt of what's going on. But I think people misunderstand. I think cholesterol may be a meaningless marker, but in terms of all the other lipids, you look at that people understand cholesterol as their lipid panel. So to me, apolipoprotein B is the key marker.
And if people want to get your new book, New Rules of Aging Well, where can they get that?
Anywhere. Amazon is probably the easiest, but bookstores used to have it, maybe not anymore.
And so are you working on any new books?
No, I'm done. Art, I've gotten old. I'm not interested in books. Books are. I've written 7. It's enough. I'm focusing on. Yeah, no, I'm not. Probably. I don't know if I'll write another book.
Yeah. Well, there may be another book in your future because it sounds like you have a plethora of information to, give to people. And we thank you so much for being on the show with us today.
You're welcome. Thanks for having me.
Yeah, thank you. Dr. Frank Lipman.